does not always mean that somebody has a serious medical condition. However, if it persists, if the swollen feet persists alongside with other signs and symptoms, then it calls for attention. Peace and blessings to you. Welcome back to the channel. Have you ever wondered what is the cause of a swollen feet? Nobody wants a swollen feet, but sometimes you just notice that you have a swollen feet or a swollen ankle. So today we'll be talking about the causes and actually what you can do to remedy the situation. Welcome back to my channel. If this is your first time, you're so welcome. Remember to give this video love and like, subscribe to the channel and become part of the family, and also hit that red button to always be notified whenever I upload a video. Prolonged standing or sitting will definitely cause fluid retention in the feet. And if you make some movements or walk around, it's going to relieve that, because that will engage the muscles that are causing those retention and blood flow will increase. The second thing I'm going to talk about is injury or trauma. The first thing that the body does when it has a trauma or an injury is to create swelling around that injury. That is how the body actually heals. So when you have an injury or a trauma, what you actually need is time. You ought to buy a lot of patience and time, and the healing will always depend on your vascular system. Pregnancy is not a disease, but is associated with swollen feet and swollen ankle because of the hormonal changes that occurs during pregnancy. Even in menstruation, sometimes the leg can also be swollen because of the same reason, which is the hormonal changes. In pregnancy, the growing uterus can put pressure on the veins around the pelvic area, and this will cause a lot of fluid retention because it becomes difficult for blood to flow from the legs back to the heart. If one has eclampsia or preeclampsia in pregnancy, it causes the leg to be swollen sometimes. And all you need in this case is bed rest and talking to your physician so that your physician can monitor you properly. Infection is another cause of swollen feet or ankle, especially cellulitis. Cellulitis is a skin and soft tissue infection, and this can cause a swollen feet. And once the infection is treated, the feet begins to heal. As we age, because we have a one-way valve, as our valves begin to get weaker because of age, the force of gravity will begin to pull things back. And most of the time, the only remedy to this kind of situation is elevation of the legs are almost above the heart with some cushions and also compression. Another cause of fluid retention is also medications. And some of these medications are things like your non-steroidal anti-inflammatory drugs, for example, your naproxen, also the corticosteroids, and some anti-diabetic drugs like the thiazolidine-diones. Yes, some of these drugs can cause fluid retention. But the good thing is that once the medication is discontinued or substituted for another one, it eases off heart failure. Once your pump is not working very well, you tend to retain a lot of fluid. And in this case, your cardiologist will place you on cardiac rehabilitation and a lot of exercises that will help rehabilitate those pumps in your heart. And once the heart failure is treated, the fluid retention, which is the swollen ankle, begins to ease off. Another serious health condition that causes the feet and the ankle to swell is when your kidney and liver begins to fail. It obviously affects the excretion process of the body, and this comes along with other symptoms like weight gain, fatigue, and so many other things. And for this, you need the attention of the physician. Lastly, guys, eating too much salt will increase the sodium content of the body, and sodium encourages fluid retention inside the body. So I will encourage us to take care of our kidneys and liver and take less salt to mitigate this effect. Thank you so much for watching. See you in my next one. Bye.